Well, I can help with that.
And at the same time, we're tired of not having any input in all the decisions that are being made for us.
Well, I don't know if they're being made for you. They're benefiting somebody else.
They're being made.
You're pretty much being squeezed out, and yeah, that's about it. You're going to be put out of business. And the only doctors left are going to be the ones that are paid for by the government. And we're going to end up with socialized medicine, and our treatment's going to go down the tubes.
Well, you
And
know
it's
what's
going to be
happening
long
right now?
lines. People will die before they get help.
The hospitals and hospital systems are trying to make these contracts with the government, essentially, with this accountable care, they call it. And basically, they want the government to just give the hospital a lump sum of money, and then the hospital will dole out what they think that it should be given to the physicians after they've taken care of. And it's really it's a big threat to private practice, but
Yeah.
it's a big threat to people being taken care of by the local physicians, by people who care for them. And we're intimately involved with our patients now. We have, I had a lady that came in today that had, her daughter's a drug addict. She's 61 years old, morbidly obese. She adopted her 3 grandchildren to raise them. And she's got health problems that she can't even afford for some of the stuff. I gave her medication today that, I'm really not even supposed to, because the government would say, well, you really can't give it to this person because she's on Medicare and doesn't qualify to have this treatment or that treatment, and it's the right treatment for her.
See, I think that part of this healthcare law angers me the most. I really don't think anyone other than a doctor should be determining the effectiveness of treatment. I think you've gone to medical school and you're licensed to make those decisions. What treatment is recommended or prescribed, what medications. I think it's a decision between the patient and their family and their doctor as to what course of treatment they follow at whatever stage of life.
Well, our patients are very nervous. We have a large Medicare population. And
Well, it's already been cut by this
well,
law.
$500 billion by this law, and they're nervous because they do require a lot of care. And when we talk about end-of-life issues, they're worried that is there going to be mandates put on them on their end-of-life care as they get older, or are we going to make the decision on how to treat them?
Well, I'm here to tell you I'm not allowing anybody to make an end-of-life decision for a family member of mine. I would litigate. That would be ridiculous.
Have you ever, we've all had someone that had a serious illness. I'm sure you know someone or even a family member. And you know how they were taken care of. And I think that we have the best medical care anywhere in the world, despite what some people say.
No, we do.
And we do.
We do.
And if that is going to change with this health care reform.
It has already. See, the health care bill is no longer a bill. The health care bill is a law. Now, it's a little confusing because they've played a game with the people. They passed the law, but they didn't make it effective right away. So they're going to collect